Right, let's see. Give me just a moment. Video. There we go. Okay, I think I have all my technology working. Very good. Okay, and good. Welcome. All right, and Danica, please just let me know that you're here, and let me know, Danica, too. And those of you here, thank you for being here with me. Give me just a sec. Great. Is Marty sideways for you as well, Danica? Um, I want to. She is. Okay. All right, but I'm upright. It's important, Marty, that I'm upright. Okay. Okay, let's see. Okay, okay, good. Marty, you can be upside down. I don't know why you are, but I accept you upside down. Okay. I want to welcome those of you who have not known me as long as Marty has to my presentation, my workshop on brain, body, and mind, a three-prong approach. Hello there, Mira. A three-prong approach to healing ADHD symptoms, forgetfulness, and brain fog. We're going to talk a little bit too today about kind of detox because it's one of the legs of the stool that I'm going to be presenting to you. So I'm going to throw in some extra stuff here because it's the first of the year that I hope can be beneficial to you. You can have your camera on. I have us in AV mode right now instead of presentation mode, but I'm going to put us in presentation mode and then you won't be able to see everyone. But if at some point you want to turn yours on, I welcome that. It's nice to have faces to talk to. And then Danica is going to be assisting me. She's not listed here as Danica. She's listed as another version of me, but she's here in case you need to put anything in the chat. And at any point, Danica, of course, if anything goes wrong with my audio or my video, please chat me and let me know that something shifted. So I always have more than an hour's worth of material. So I definitely want to make sure I get going here. And I want to ask you if you're okay, because I see there were a number of people who signed up whose names I was not familiar with, who aren't on here, who I think are going to probably view the recording. But if you are here and you're willing to share just what your interest was in this particular presentation, this workshop, and you're up for sharing it and want to put that in the chat, feel free. And I'll tell you here in just a second a little bit about why this became just something I was obsessed with, this three-prong approach to healing. Okay, that's going to be on my presentation here as I get going. So let me see if I can switch us out of AV mode. That would be amazing. Good. Okay, I've got us moved over here. And hopefully the lights behind me aren't too obnoxious. So, okay, so I'm Dr. Tiffany of Doc Brownbush Integrative Therapy. And if you just saw this information and decided to check it out, I definitely welcome you. And we're going to talk about ADHD symptoms and using my holistic model as you see here. Let me make sure my pointer's on. Okay, I've got a public pointer. I believe that when people come to me, the reason that they're still struggling, okay, based off of years and years of study and years of personal experience and blood, sweat, tears, and other people's blood, sweat, and tears, is because they did one of the legs of the stool. Maybe they got lucky. They'll come in and they'll say, well, I have a therapist, psychological, and a chiropractor. Okay, that's neurological, right? They might have gotten lucky and done two legs of the stool. Or maybe they just did kind of like a talk therapist and a psychiatrist. Okay, so that's doing the two legs, that's doing the physiological, that's doing the psychological, but they're like, I can't get healing, I can't get healthy. Thank you, Marty. I can't figure it out. And I said, you know what? It's like people are wobbly. Do you know what I mean? It's like the stools just kind of like they don't ever feel stable. And that's how I came up with this model of it being like a three-leg stool. And I believe this, like my life depends on it. And it at times has felt like it has. And there have been clients in my practice and patients whose lives have depended on it, where we had to look at stabilizing the whole stool for them to actually get their lives back. Okay, and I'll tell you a story about a client here as we move on where that was the case. Just very briefly, because I think I could spend a lot of time on this. I'm a solo integrative practitioner in the Lake Norman area. I am trained as someone who operates in all three domains, I have training in functional neurology. I have a lot of nervous system training now, because it just was absolutely necessary. I am very pleased to say that I am trained in functional medicine and trained as a naturopathic doctor, a traditional naturopath. But I recently completed 2.5 years, 300 hours with Dr. Karazian, Datish Karazian, who literally wrote the book, Why Is My Brain Not Working? And he is one of the best to have ever done it in functional medicine. And I became a naturopath in 2011, 2012. I started down this path, and I picked the school I went to because it would allow me to work with him. He has all the strict criteria around who he would work with, and I wanted to train under him. And I went down the path I did as a naturopath because he wouldn't work with me as a licensed therapist. He didn't care. So I said, okay, well, what can I do to work with Dr. Grazian? And literally, my life changed because I tried to pursue working with him and got chosen to do clinical mentorship. And he and Dr. Amen probably are single-handedly responsible for saving my health from lupus. Um, because these men are brilliant and they're out of the box thinkers. And this transformation that I've experienced is something that I'm supposed to share with other people. So when I tell you these things, they're because I've lived them, I've watched my clients live them, and it's game changing knowledge that I have access to. Dr. Krasian takes 2 weeks out of every month, and he won't even see patients. He just spends hours in research. So we depend desperately on him to have the most cutting edge research, and he is um, just a perfectionist. So we don't use it unless it's been like filtered and blessed and all of these things. So I'm super grateful to have the most cutting edge functional medicine information available to me. So that's one of the trainings under that physical leg of the stool, that body leg of the stool, that I'm super proud of having access to. And then a lot of other things. I'm trained in Alzheimer's. I spent a year under Dr. Bredesen's training to become a pre-code and recode practitioner. If it is brain related, I'm fascinated with it because I need us to really think about, if our brains aren't working, what do we do? Right? There's cardiovascular support, there's organ support for a lot of other areas of the body. But if we lose our minds, it's game over. And I felt like it was really a misstep to be someone who was treating people psychologically who didn't have mastery of how the human brain works. And that's part of why I doubled back. And I think as you hire people to work with yourself and your children, think about that. Does this person understand the organ that they're treating? And if they don't, maybe take a moment of pause. So even if you don't work with me, I want you to be very particular about who you hire to work with your children, to work in your family, because understanding the brain speeds everything up. Okay. I love working in ADHD. Trauma impacts ADHD a lot. So that's part of that training. And then all of the different areas that I work in and my specialties are here, but it all comes down to immune system, brain health. Um, that's pretty much where I hang my hat. So moving on to what you're here for. I had a lot of things happen health-wise. That is the summary of this slide. And because of that, I had to come up with a whole method that made sense, that combined all of these brilliant people I was learning from that I could apply to myself. And then I had to put into practice in my practice. And when I tell you some of the changes that I've seen as a result of this method, because I had to learn it for myself, it's just been amazing. I do see some people still individually, but my heart is really in doing brain assessments, doing intensives with people, working deeply with them, and doing intervention style work. And sometimes intervention style work means I see people on a regular basis, but oftentimes when I'm doing interventions, it's 3 to 4 times a week types of things for weeks and months at a time. Okay. So that's where I find myself now. So assessments, intensives, interventions. So a lot of times people will come in with a brain health assessment. Um, Why are you here? Okay, so Marty wants to learn more. And Amira is signing on with you soon. Have going through perimenopause. Yes, all the things. Right, 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 right. All the things. So I want you to think about your pain. Okay. I want you to think about your pain. Here I said the pain would be the ADHD symptoms, the forgetfulness, the brain fog, right? And fatigue, bloating, cellulite headaches. I threw those in as I thought about this presentation because a lot of times my clients who are coming to me with the psychiatric, psychological, neurological diagnosis have a bunch of things going on physically that they don't think are related. They have a bunch of things going on physically that they don't think are related. And come to find out it's all the same because the body, we do this thing in medicine where we have specialties. And so your cardiologist doesn't talk to your rheumatologist, doesn't talk to your neurologist, which is like, and it's a whole system. It's a whole system, right? The body didn't get the memo that these areas don't impact each other and, there's a separate practitioner or clinician for each one. So when someone has brain fog and they also have fatigue and bloating, those things are related, right? When someone is having fatigue and ADHD symptoms and headaches, those things are related. So think about what your pain is, and even if you don't share it with everyone here, please make a mental note of what it is. Okay, why did you take the time today? And then what solutions? What solutions? What solutions have you tried? Have you tried to understand the holistic solutions that would balance your stool of healing? Have you tried Western medicine? Right? Have you tried Western medicine? What is it that you've tried? And when you think about the stool that I mentioned, does it kind of make sense to you now why you haven't gotten where you want to be? So if it's your child, a lot of times if it's an ADHD diagnosis, you're not going to get a holistic solution. Right, you're just not going to. So if we're talking about the pain of ADHD symptoms, and let me say this now, and I want to say it on record, I don't have this feeling of ADHD is something that I need to fix. I was part of who helped my husband become diagnosed with ADHD. I He and I both struggled with his symptoms of ADHD. The symptoms. And if you live with someone who has ADHD symptoms, you will want those to go away. Okay. So it is one loving mind to another. Those can be very problematic. And ADHDers tend to be absolutely amazing. They think outside of the box. They come up with creative solutions. They can be spontaneous. They can be, and very verbal even, and great interesting minds. Right. A lot of the success we've had in our society comes from ADHD minds, but ADHD does have symptoms. I tell people with the diagnosis of ADHD, it's like having a Ferrari car with bicycle brakes, right? It's a Ferrari with bicycle brakes. That's a problem, right? It's a lot of horsepower and it's hard to manage that particular brain sometimes. And those symptoms of ADHD can be managed. Now, there's pills and skills. So I will give people supplements and I'll teach them about the neurological leg of the stool. But then there are those mindful psychological based pieces where people need to learn techniques. But I will tell those of you who are on the call and who are listening who have children who have ADHD, it is so much easier for them to receive and for them to be taught once you get their brain and body managed. You were trying to do something with your hands tied behind your back. If their brains aren't balanced, because ADHD is a neurological diagnosis, it is not something that a regular therapist is at all trained properly to treat. It just isn't. It's a neurological diagnosis. They are neurodivergent. They diverge brain wise from typical brains. So you have got to get that neurology balanced. You've got to balance the areas of the brain. You've got to give them what their brain needs. And I tell you, you treat ADHD in a young brain, and that is money. That is long term life change and success. The later you wait, the harder it is, okay? But you give them what their brains need, you change their diet, you put them on an ADHD friendly diet, all those things and those symptoms are easier to shift. So that is why we have that three-leg stool. Okay. So I just want to always say that because people will think I'm trying to fix ADHD like there's something wrong. And that's not, I'm not in an ableist mindset here. Forgetfulness, no one wants to keep that, so I can speak about that freely. And brain fog, that doesn't serve anyone. Okay, there's not anything bright and shiny on the other side of brain fog. So we're trying to work on that. And what I am saying is the solution is going to come from all three legs: brain, body, mind. Okay, so that's what we're talking about here. Okay, so we're going to get right to the pain and the slides. If I feel like you need to capture a slide, I will tell you. There's going to be a little camera, a picture of a camera on the slide. I am going to mostly talk, okay? So there's, you know what brain fog is. There's not a whole lot on this slide, but I want to make sure that you're clear on what we're talking about. And it's that slow processing. It's going to be lack of clarity. People who have brain fog feel like there's a bit of a delay when you're talking to them at times. There's that mental confusion, plus they can be quite moody and irritable. There's a lot of mental struggle because everything is hard. They'll forget names, they're forgetful and leaving things, right? So they're constantly like missing a step in their processes in their brain. I already said the slow processing speed, and brains feel disconnected and tired. And so maybe that's you, maybe that's someone that you live with. Brain fog oftentimes is coming from neuroinflammation. Brain fog's oftentimes coming from neuroinflammation. So something has the brain inflamed. So this isn't something you're going to deal with in a therapy office. I don't quite know what your Western medicine practitioner would give you for brain fog other than Adderall. That's what I've seen show up a lot for people, which is not appropriate for brain fog. Right? It's not an amphetamine deficiency that has you foggy. Okay? It's the fact that there's inflammation in the brain. In the lupus community, there's lupus brain fog. In the fibro community, there's fibro fog. These are high inflammatory communities. The inflammation causes the fog. So why would your brain be inflamed, and where would that be coming from if you don't have a diagnosis of autoimmunity? Exactly. Where would that be coming from? My job is to figure out with my method. And so I want you thinking about these types of things. Where could your brain fog be coming from? If you don't have an autoimmune disorder, what's causing that inflammatory process? Okay, I'm going to give you some ideas in just a second here, but something's causing it. And brain fog is coming from neuroinflammation. Okay, ADHD symptoms. We're going to get all the pain clarified here. Okay, so ADHD is attention deficit hyperactivity disorder. Okay, so if you have the hyperactive type, there are different types, right? So there's more of an inattentive type. We don't do this whole thing of ADHD, ADD anymore. So if your practitioner is saying ADD, we don't do that. That's like an old school way of distinguishing them. It's all just ADHD, even if it's not a hyperactive feature. We just then say inattentive type, or there's like a sluggish tempo type as well. Okay. And so I just want to clarify and say that ADHD is not usually a lack of attention, it is a lack of regulation of attention. It's a lack of regulation of attention. Anyone who's been with a ADHDer for any amount of time knows that they can focus, not when they want to, when there is dopamine, not not when they want to, when there is dopamine, and that's different. Okay, that is a body-based function, that creation of dopamine. So if they're in a high dopamine um, experience, they're going to end up hyper focusing, which is what we can see a lot of times. Okay, so symptoms of ADHD would be an inability to be productive, so unable to be productive, not following through with things, not able to get started. One of the hardest things that ADHDers struggle with is starting a task. procrastinating, right? Putting it off, forgetting what you read as soon as you read it. If I had a dollar for every time an ADHDer told me that repeatedly, okay, they forget things as soon as they read them. And that's a working memory issue because executive function includes working memory. Okay. So that means that as you're holding on to it and you're reading it, you're supposed to move it back to long term storage. They don't do that. Okay. So that's a side effect. That's a symptom. That's not helpful. There's nothing bright and shiny about this. Most ADHDers don't want to keep this. Okay. They would like to read it once, not five times, and try to then remember it, right? Impulsive choices that don't align with responsibilities or values. Typically, when I get my practice is 85 to 90% neurodivergency. So when I get an ADHD, I'm looking for the impulsive, compulsive behaviors, right? Because they're dopamine seeking brains. So they're going to look for things that give them dopamine. So there's usually an impulsive, compulsive component, and then emotional dysregulation. So, one of the biggest things that shows up for me is that people will think that they have something like bipolar or some extreme emotional diagnosis because they're emotionally dysregulated. I believe that we need to work with that and back away from so much pathology and diagnosing. Emotional regulation is a responsibility of the prefrontal cortex where ADHD lives, and people will have highs and lows as a result of a prefrontal cortex that is not working properly. When you stabilize all three legs of the stool, this emotional regulation becomes way more manageable. It falls in line. Okay. So these are the ADHD symptoms that with my method I look to address. And what I'm asking you to do is to see these as symptoms that could be managed with the right intervention. And what I find is with the traditional interventions with Western medicine and talk therapy, um, you end up needing more and more medication to try to manage these symptoms. So you might start with an ADHD med like Concerta, but I promise you, everyone ends up on a total of four medications between the anxiety and the sleep issues and something that's longer lasting and all of the things, especially in children, there's a lack of appetite. So we end up on these different things. We want to try to manage the symptoms with a holistic method. And it's hard to do this if you're a parent that's or an adult who has ADHD who's trying to do this with natural methods and hodgepodging your own supplements together. This is complicated. This is a complicated thing to do. Okay, and the last pain we want to look at is memory issues. So what is memory? What is memory problems, right? What are those? Forgetting appointments. People will show up to my office at the wrong time. They'll show up at the end of their appointment, right? Those because they remembered the end as the beginning of their appointment. I have people in my practice with dementia as a diagnosis and Alzheimer's, so they start to forget all kinds of much more serious aspects of their life. One of the things that shows up a lot with some of my families is children who start to feel like their parent doesn't care because the parent is getting confused and not remembering. And your children don't always have enough empathy. And if they have ADHD, they may struggle with empathy. And when you are confused about something that they told you and you don't remember it, they may take that and do something different with it than ever was intended. They personalize it. They think you do it on purpose. It's fascinating what a 16-year-old or even a 22-year-old will come up with when their parents' memory is not good. So it can cause a lot of unnecessary suffering. Forgetting what you read as soon as you read it, right? If you're having memory issues. Now, instead of this coming from the prefrontal cortex, it's coming from the hippocampi in the back of the brain, but you're in the temporal lobes, okay? You're just not remembering things. Struggles at work, having memory problems at work is a problem. It's not good for work, right? This shows up with a lot of people and they start to really have all this unnecessary anxiety because they're going to be found out. They're not remembering. I have people come to me with ADHD and anxiety and depression because the ADHD symptoms have caused all of these mood issues. Same things with people whose memory is starting to go. So this can cause a lot of problems. And again, appearing dismissive and uninterested. So these are our problems. Think about, are you having some aspect of these? Maybe you're having some of the focus issues, but you don't have ADHD, but you're having some of those challenges, right? Maybe something's going on with your prefrontal cortex. Um, Maybe you're dealing with brain fog like I was. I was having severe brain fog at the height of my diagnosis, and it was really tough. Um, okay, so let's talk about the body. So this is a slide you might want to take a picture of. Okay, so what is my theory? All right, so if we're going to look at these three areas and we're going to resolve them, what are we supposed to do? Okay. Now, you're not supposed to do all of this on your own. Okay. So let me just say this. Me or someone like me is supposed to help you. But if you're here and you're like, I've tried to do it all of the traditional ways and I'm not getting success, I'm not getting focus back, I'm not clearing the brain fog, you're here because you're trying to do something different. Okay, so we start with the body. We always test, we don't guess. You don't have to do all the tests, but you're going to have to test. Please make that note. You're going to have to test. Now, I'm going to say, for me, basic testing is blood work. I didn't even put it on here, but basic testing is blood work. You can't even work with me anymore if you won't do blood work. The children, the teenagers, I have to have blood work. You have to do blood work. So I just consider that a given. Okay. But you also test sensitivities. Now, I don't do all these tests. People come in and they screen. So I do a screening. I do some questionnaires for, like, do I think this is food sensitivities? Do I think this is environmental toxins? I do some screenings, and then I will tell, Danica and the team, hey, we want to go ahead and order some labs. A food sensitivity lab, that's what this colorful one is here. A stool test, right? And we might test for toxins, right? And we are in a very toxic environment. A mother to her child in utero is going to pass something like 265 different toxins to her child in the umbilical cord. You can't help it. So now I have moms coming to me trying to do detoxes if they know they want to get pregnant in a year or so. So I detox mom and dad so then they're not using their baby as a way to detox their system, because that's just the way the human body is designed. Okay. So usually what I'll do is, if you're like, Tiffany, I have brain fog and all my labs are normal and Western medicine says I am fabulous and that most of this is in my head, I now need to go talk to a therapist. I've been talking to a therapist and that's not working. And they put me on a med and that's not working. I'm going to say, okay, let's do all the questionnaires and then let's do a couple of tests. And you might be someone who says, you know what? I think I have an issue with this food or that food. You might be on here today saying, I already know I have an infection. Lyme disease is going to cause brain fog. It's going to cause memory issues. It's going to do all kinds of things. Um, I am fatigued. Mitochondrial health is about fatigue. Okay. So when people tell me that they can't sit and read without getting really sleepy, or if they tell me that they're having energy dips later in the day, I'm also thinking about their mitochondrial health. If someone has an autoimmune disorder and they're really fatigued, what we do with my team and the neurology team that I work with is we're testing their mitochondrial health. Almost everyone who walks in my office with this combination of issues has mitochondrial toxicity and problems. So it's not a Adderall problem when someone's fatigued, because people will get Adderall for their energy problems. We need to help build the health of the cells, and the mitochondria in the cell are very tired. Okay, so I'm testing all of this to say I'm testing, and then we're going to remove some obvious problems. We're going to remove sugar. I have a whole presentation about like how much sugar people should be consuming and how problematic sugar is, but it's super inflammatory, it's super problematic. It will exacerbate your ADHD symptoms. One of the biggest things I did with my husband and our healing journey with his ADHD symptoms is we really had to remove gluten and sugar. And then when I tested him, he has allergies to everything. So he was allergic to things, but he was also sensitive to things, and all of those things were irritating his brain. That other leg of the stool, right? So what you're doing is you're removing these inflammatory um, agents so that the brain can function properly. Okay. It's not that the sugar makes your child or your husband hyper or irritable. It's that it bothers that person's brain. It's inflammatory. Your biggest issue is all of the inflammatory substances that your brain is having to engage with. And the list is so long nowadays. And when Marty was a child eating sugar, her environment was not like it is now. Okay. So, I know Marty, I tell my grandmother, you had a different life. It's just like my nieces are in a very toxic soup bowl now. There's just so much. Then their brains, we were not designed for this kind of environment. So then you're not being cruel if you limit the amount of sugar your child eats. I'm sorry they can't have the childhood that you did, but their environment is different. They have smartphones and tablets. Life is different now. So we also watch the synthetic sugar substitutes. We don't do sucralose. We don't do aspartame. We're really looking at those things that are obvious. And then toxins. I am actually going to be doing a 5-week toxin challenge, a detox, because I believe very heavily a lot of times what people are dealing with the brain fog, some of this weight loss resistance, a lot of the issues with just brain function. My training shows that there's a heavy toxic burden that most people are up against, and they don't even realize it. And young people in my practice come in all the time and they have a toxic burden. Um, from the plastic they're drinking out of to the plugins, the Glade plugins, all of these things, a lot of the times these children aren't detoxing them. Okay. And then what we call subclinical stealth infections. So Epstein Barr or Lyme or things like that, gut bacteria, candida, all these things. We want to try to remove those things. And I want to say this because so many people right now are taking Ozempic or I can't remember something Govi. I can't remember the name of the other one. Forgive me. Um, when you lose weight, toxins have an affinity for fat. So as you lose weight, you're dumping the toxins into your system. And if your detox system doesn't work properly, those things can recirculate and actually cause a lot of problems. So as people are having these large weight losses, but then their numbers don't look good, and I've had this happen in my practice, their actual blood work doesn't look good. It is partly because the toxins that your body had the wisdom to sequester in your fat have now been liberated. So as people lose weight, they are really supposed to be detoxing. So this won't apply to the children, with the ADHD symptoms, but people who are having memory and brain fog problems really need to be detoxing often. And in my family and my journey, my mom developed cancer at 40. My grandfather developed cancer in his 60s. When I ran all of my genetics and so forth, we are terrible detoxers. Genetically, we don't detox well. Part of what drove some of my illness was poor detoxification. This kit that I have here is a kit that I will probably be utilizing for the rest of my life because I don't have the good genetics for detox. Okay. And in my family, when we don't do that, we develop cancer. So I just think the basics of how to keep the body working properly are important for all of us to be aware of. And then you want to add in things, whole organic foods, right? Um, the dirty dozen and the clean 15. You want to eat whole organic foods. You want to have clean water, clean protein, clean fat. And so that's going to be wild caught meats and wild caught fish rather, and free range organic meats and things of that nature. Um, and I will say, while I'm on body, and maybe make a note of this as a tip, just something like a pro tip. The ADHD diet is high protein. A lot of times when I go in and I work with families, the very first thing that I do after I get all of these assessments done is I say, I do this before we even do these labs. I will say, before I even do any labs, I want you to put your child on this many grams of protein, and I want you to start their day with protein. So that could look like eggs, that could look like chicken sausage, turkey bacon. That could be lunch for breakfast, and a very small amount of carbohydrate. Instead of giving your child a bowl of cereal or some waffles, I want you to give them a hearty breakfast. You cannot make dopamine with waffles. You can't make the secret sauce that an ADHD brain needs with oatmeal. We need fat and protein. The brain is a very high percentage fat. You need fat and protein. So if you just started working with me right now, big reveal, I'm going to put your child, your whole family, because it's very hard for your child to do this if everybody else isn't doing it, on a high protein diet. You get carbohydrates, but you start the day with protein. A symptom of ADHD is oftentimes they're very poor sleepers. They have a hard time waking up in the morning, and then they want to stay up all night. And the way you deal with that is you give them that high protein, high fat breakfast, and then you give them carbohydrates at night. Carbohydrates release serotonin, so then they'll be able to sleep. Okay. How do you just give a child Adderall and you don't work with diet when so much of what's going on is what we put in our bodies, right? So that is why the stool is wobbly. That's why the stool is wobbly. So we test, we remove, we replete. We test, we remove, we replete. And so you heard me say a lot of things here. You could, maybe you can't test, but you could immediately start to remove some things and add some things in. Okay. All right. So next we look at, you'll want to take a picture of this one. We'll look at the brain. Now, let's say you reach out and you want to work with me. Danica and the rest of the team, they're going to send you a ton of questionnaires, and it's going to be a lot of things to fill out. And I don't know if you're familiar with the Amen Clinic, but please, if you don't know about Dr. Amen, I don't have a book here readily available. Please look into the Amen Clinics. I can't get into how important they have been in my work, but this is an assessment that I do with them where I try to figure out which areas of the brain that you're having problems with. And let me see if I can zoom in and move this over so you can see it. And Danica, is this blurry on your end, or can you guys see this? Um, Okay, so overview of the brain and function. So these are there are a lot of brain lobes. So let me just be super clear about this. But the ones that we care about and want to target when you come to see me are going to be the ones that are here. Okay. So the prefrontal cortex, this is the part of the brain. Very good. Thank you, Danica, where there is ADHD diagnosed. Okay. Now I put this in air quotes because I have strong feelings about how we dole out these diagnoses these days. So functions are going to be attention, judgment, planning, impulse control, follow through, and empathy. This is a part of the brain that does this. This is a part of the brain that does this, right? Okay. Problems, inattention, poor judgment, lack of forethought, impulsiveness, procrastination, lack of empathy. I work so often with adults who struggle with empathy because it's a prefrontal cortex. Can you imagine going to somebody for therapy saying you have a lack of empathy and they don't know how to treat ADHD? Can you imagine the waste of time that is? Okay, because therapist is a licensed therapist. We like to think about all kinds of pathology with a lack of empathy, and it's a prefrontal cortex responsibility. It's actually with front part of the brain does. And so if you have an ADHD diagnosis or if you have a head injury, which a lot of my clients do, I send my clients for SPECT scans at the Amen Clinic all the time. They come back with like holes in the prefrontal cortex. They're not getting blood flow to that part of the brain, right? So then they have a lack of empathy, but they've been in therapy for 5 years before I got them, trying to work on empathy, but not treating the prefrontal cortex. Um, what am I trying to tell you? I need to know which part of your brain is having problems. And then I need to target my supplementation to deal with that brain lobe. So the questionnaires that I'm going to send you are going to be about your brain lobes. Okay. Not about how you feel about your mom, or just your relationships. I need to hear about your brain lobes. Okay. Temporal lobe, forgetfulness, moodiness and irritability, anger, trouble finding words. You know how many men come to me with head injuries, car accidents, rattled their brain. They got their bell rung when they were playing football when they were younger, and they don't have enough blood flow to one of their temporal lobes, and they're having these issues, and they've been in therapy trying to fix a brain problem. And this is the kind of stuff that makes me incredibly frustrated. People waste a lot of time. And if you are taking medication for your temporal lobe, so a lot of times it's going to be something that stabilizes the brain a little bit better. Sometimes it can help, but do you know how problematic it is to have poor blood flow to a brain lobe for 30 years of your life and then be on some sort of antipsychotic? That brain develops Alzheimer's. That brain develops Alzheimer's. So good good support of dealing with all of these struggles looks at the three legs of the stool. We've got to understand how the brain works. And that Dr. Amen and his clinics, Dr. Amen was a psychiatrist and he's a neurological specialist and brain imaging specialist. And he said, we're the only field that doesn't look at the organ that we treat. People come in and they say all these things. They say things like, I'm moody and irritable and I'm angry. They don't also get to tell that therapist or psychiatrist that they have a hard time finding words or having processing problems because those aren't the buzzwords that the psychiatrist or therapist is looking for. So they just say the moodiness part, right? And then they go on an antipsychotic. It is literally that easy to get a script. You can fill out some questionnaires that are just about feelings and then get on a prescription. Meanwhile, we're not listening to what is going on with the brain lobe. Okay. And I just feel like it's dangerous. I tell parents when they tell me that they're bringing their child in because they have a diagnosis of ADHD, I am going to spend in session, in office, an inordinate amount of time testing the cerebellum. So the cerebellum is at the back of the brain. So this is the cerebellum right here. And I got the privilege of spending a year and a half learning from someone named Dr. Malillo. If you are here because your child struggles, I would recommend that you go look at Disconnected Kids. He has been a trailblazer. He's the gentleman behind the brain balance centers that are all over the country. At one point, I think there were 150 brain balance centers. From him, I learned about functional neurology and pediatrics. Up until 2012, something insane. We didn't understand that the cerebellum was actually controlling all of the other brain lobes, all of the other brain lobes, and that it innervates very heavily to the prefrontal cortex. I cannot tell you how many people come to me and actually have underdeveloped cerebellums because something happened when they were a baby. They weren't moving around, crawling around, developing their cerebellum very well. Your kids roll around and then they stand and they fall down and then they try to, do things and they cruise along the furniture and then they like to spin around and they hop up and down a lot. All of those things are the way that they develop their cerebellum and ultimately will develop their prefrontal cortex. I have cerebellar problems. I just tested somebody yesterday who had all of these cerebellar indicators, right? And is having a lot of mood problems. So that same temporal lobe that we just looked at with all of that moodiness and irritability or problem finding words or forgetfulness, it also ties into the cerebellum. So then how do we just treat people without testing their brain? right? How do we just give them medication and not see how their cerebellum is functioning? If you can't stand on one leg with your leg in front of you, with your arms by your side, right? And I don't know if you can kind of see, but I've got my knee up here and I'm on one leg. If you can't do that without getting wobbly, that's a cerebellar test. If you do that with your eyes closed and you immediately fall over, we now have a problem with the cerebellum. And I do more and more and more tests like that in the office to look at cerebellar health. And then what we do is I give you the supplements and I do all this talk therapy, you're also doing cerebellar exercises. You are doing neurological rehab on your own brain, right? So 80% of what is going on with you, with your child, personally, what was going on with me was coming from my cerebellum. So then what do? I do balancing exercises and I use a vibration plate and I jump up and down on a rebounder and I stand in a corner and try to do things with my eyes closed and try not to fall over. And you do things to just rehab the brain. You do things with timing. There's all kinds of things, but you know what doesn't work for the cerebellum is medication. There's not one thing you can give someone to fix their cerebellum that is going to be on a prescription pad. And so this is why we assess the brain. Okay. So I want you to think about that. Y'all will come in as parents and say, my child always toe walked. I don't know what that's about. Or my child is always sliding out of a chair, or my kid can't just sit in the chair. They got to wrap their legs around the chair. They just, they get car sick, or there are all these things that have to do with how your child's brain actually developed that are called primitive reflexes. When you would go to touch your child and you would put your finger inside of their hand and they would close their hand around yours with just instinct, that was a reflex, right? A lot of these reflexes never go away. And I'm going to point here to the brainstem coming out of the bottom of the brain. Those primitive reflexes stay in the brainstem and then they destabilize the cerebellum. And now you have a child with a mood disorder. So when I get children, I am fixing things in the brainstem, balancing the cerebellum, and then giving supplements for these brain lobes. And then the last thing I'm going to do is talk to that brain. Okay, it's just like I don't need to talk to your 10-year-old. Just let me put them on a vibe plate. They love coming to see me. Just vibrate, throw things. Let's play with the game. There's all these games that we play to sounds. I had a third grader that was not about to go to fourth grade, couldn't do math, couldn't do ELA. One of the I'm doing a case study right now for Dr. Malillo. One of the biggest successes in the practice, and the teachers wanted the kid on Adderall, and the parents were absolutely desperate, and they did everything. I asked for crazy things. They did everything I asked. And he is eating a ton of protein, and he is now at the top of his fourth grade class in math. He's just astonishing what he's been able to accomplish in math. ELA scores are through the roof. Now we're working on other things. We are not working on brain-based ADHD symptom kind of things. We're working on, like, speaking up and things like like that. Like, eventually this child is not going to be in my practice anymore. We fixed it, right? But it's only because of the three-leg stool. So I want you to kind of keep this in mind. And I talked to you about the cerebellum health. So let me move on to this last one, mind. So now this is what everybody wants when their child is struggling, or they are personally emotionally struggling. We say we need a psychologist, okay? And so here's what I would push back on a little bit with psychology. And I tell people when they bring me their family members or adults. I just started with an adult not that long ago, and we're working on all kinds of things. And I'm like, I'm not your normal talk therapist, right? We're going to talk about your nervous system. We're going to talk about automatic intrusive thoughts. That's what those automatic negative thoughts are, those ants. I'm going to teach you about polyvagal theory. Okay, which is feeling threat, which is sympathetic dominance. That's that red, and wanting to get into fight, flight, excuse me, I'm sorry. Wanting to get into fight, flight, freeze is sympathetic. Wanting to get into immobility is going to be that collapse response. And then I'm going to talk to you about green and safety, which is when you're socially engaged. I'm going to teach you how to map your nervous system, which might have very little to do with what's going on for you psychologically. So we do things very differently. So they learn polyvagal theory, they learn cognitive behavioral therapy, which is challenging your thoughts. We do a lot of emotional freedom technique. I love to do tapping. That's a way to liberate the nervous system and to combine cognitive behavioral therapy at the same time. Why wouldn't we do that? And then we do something called IFS, where we talk about the multiplicity of the personality and all the parts that reside inside of us. You do not need to go to somebody if you're having these brain fog and ADHD symptoms and memory issues and just process. 80% of what's happening is coming from the body and the nerves in the body up to the brain, and 20% is going from the brain into the body. So you have to do interventions that take into consideration the whole system and are what we call bottom up and then across the brain and then top down. Okay, so bottom up across the brain and then top down. All right. And so one of the big things I want you to take away from, and I did a nervous system rewiring workshop as well that's available in my link tree that you can watch that goes deeper into this. Talks about we talk about this polyvagal theory, and so you can take a picture of this slide as well and think about, have you been diagnosed with depression in the past? Have you been diagnosed with anxiety? Right? These are actually states of the nervous system that can get confused as psychological diagnoses that are actually very normal states for the body to kind of toggle in between. And what we're all trying to get to is green, which is safe, which is relaxed, socially engaged, and in a place where we can rest and digest. Women come to me all the time and I will say, "Girlfriend, you can't do like any of the normal functions anymore. So you can't poop anymore. You can't sleep anymore. They're always constipated and they're anxious and they're cold, right? They're not in rest and digest." Your body has internal wisdom. You're not supposed to have to like externally manipulate it to be able to go to the bathroom. It's supposed to know. Your dog knows how to do this. We don't have to work with the dog on how to go to the bathroom. You're supposed to be able to eat things and just poop those things out. Your dog doesn't need you to give it something to go to sleep. But as human beings, we have gotten so far away from our nervous system being in balance, we can't do basic functioning anymore. And I say this from a place of one of the biggest things I struggled with lupus. And because I'd had Lyme disease and that activated the lupus, I was in fight, flight, mobilization so often, my gut wouldn't work and I couldn't sleep and I wouldn't get restful sleep because my system was in sympathetic overdrive because there was a constant threat, right? So then if we give you medication, and I will have women coming to me on 5 medications because they're trying to deal with this mess of things that are occurring in their system. You don't actually get to the root cause if you're just taking a bunch of pills. You don't know why you can't sleep and digest. You don't know why you're constipated. You get further and further away from the messaging that your body is trying to provide you with. Right? So you gotta test, you gotta get to the root. And then these things that are over here are teaching you about how to calm the system down and to get more into that rest, digest, safe zone. And that to me is the third leg of that stool where we're looking at the psychology. That's the mind part. Do you have any questions about any of that? Okay. And if you need me to unmute you or Danica, we can. Okay. Okay, she's typing. So, what does an integrated treatment look like? Because this can be overwhelming. And I'm telling you today, take what you can, make some changes, make some changes to the diet. You heard me say some things here. We test. Integrated treatment looks like testing gut health, test for toxins, test for infections, assess any past trauma. And I'm talking about head injury trauma. There's a lot of like car accidents, football head injuries, all kinds of things. I personally had numerous car accidents that made my brain and my neck, the vertebrae in my neck, very vulnerable to issues. So I had a couple of pretty traumatic car accidents. Those things have to be unwound. Okay. So chiropractic care. That's someone you can go and see to kind of get an assessment of what's going on with you neurologically. Um, if you have a doctor that's not me that can test for infections, sometimes y'all are able to finagle that kind of thing. Um, Gut health and toxins are pretty specialty, but you can test, okay? Remove, so address the gut infections, the candida. If you've got signs of thrush, dandruff, thrushes in the back of the throat, dandruff, toenail fungus, athlete's foot. Your child, your family member has a candida problem. That candida problem is going to cause brain fog and focus issues. So you want to look at gut infections, remove overall infections. If you have a diagnosis, an infection, for sure, you have got to address that carefully. You have to address it carefully. Please remove toxins in and around the body. Clean air, clean water, clean food. You can start doing that. You don't have to start working with me immediately. Um, Air your house out. I'm standing in my office right now. The window's open. It is freezing, but that is okay. Air out the house every single day. I recommend doing that a couple of times a day. The heating bill is expensive. If you had seen my medical bills when I got sick, I will air my house out to keep from having to pay those medical bills. It's very expensive in general to be sick. The impact of trauma now, and then because you need to address trauma and how it's affecting you now, and then any use emotional freedom technique and polyvagal interventions to remove those emotional stressors. Detox, detox toxins, mycotoxins, and infections, and any sort of waste from the infections. I can't get into this as much as I would like, but I do test for parasites and bacteria, and they relieve themselves in your body. So there's excrement from these things that are in your body that are also making you toxic. And again, this is part of why I'm running a detox challenge for 5 weeks, because the detox piece ends up being a massive part, especially as we come out of the holidays and people have been indulging in really inflammatory foods. It ends up being a huge part of what's going on with people when it comes to getting healthy. Add in what the gut needs, the healing substances for toxin removal, and fix and feed the mitochondria, the microbiome. So that's probiotics if you need them. Repair the gut lining. We do some vagus nerve training, and we do nervous system rewiring. We combine all of these things. And I would also add in here that I didn't amino acid therapy. That's something else that I do heavily in my practice, and healthy fats and healthy foods, right? So we definitely need to update this slide so that that is reflected here. Healthy foods and healthy fats are a huge thing that you add in, right? Okay, and okay, so I am going to close out here. I'm not that far off schedule, and I'm happy to take questions. How would you get started if you wanted to work with me? Because you've got some things you could do right now, okay? That I just said, hey, start your child on high protein in the morning. If you are having memory problems, start with high protein. If you are having brain fog issues, I would really strongly encourage you to do cardio. Start doing cardio for the brain fog, okay? Because you need to flush out that inflammation and focus on sleep. So those are the takeaways. You can complete the application that Danica dropped. You can also go to the registration page. Am I able to do a quick screen share? How do I do that? Let's select a window. Oh, I don't see it here. I don't see an option for that. I won't go to that. Let me close this out. Not now. Let me see if I have a slide here for I have the Brain and Body Detox Challenge, which is a 5-week program. It's going to be starting on January the 24th. It's a little small, isn't it? And then you get this whole kit, which has like a $700 value as part of that $1,149 in that kit. This is adults. It's not something you guys that put your children on, but this is going to help you with brain fog, energy dips, focus struggles, cravings, belly bloat, dark circles, and cellulite. I never had cellulite until I started getting sick. I always would say, because, we would talk about it a lot. And then I was like, I never had cellulite. And then I got sick and I had cellulite. I stopped detoxing and my lymphatic system got really congested. These are the best detox supplements on in the market, like in the game right now on the market. And then what you'll receive is I'll do 1 week of coaching on food for detox, how to detox your food, how to detox your kitchen. Air quality is huge. Water and the products related to all of that, right? Whether it's you're buying what kind of water filter you need or what you do with the shower head filter. Berkey is one I used to recommend that has gone out of business. So I'm having to kind of recalibrate on that. And beauty products. Each week will be a detox discussion. And then there's a nutrition program that I'm going to recommend that just gets your body more into detox phase of things. And then the recordings of the Brain Warriors Masterclass. And we said the 15th, but if you register by the 17th, you'll get like a fast action, which is 5 weeks of the Brain Warriors Masterclass, just to kind of help ease the process here of learning about how I like to do things. So that's an option. If you don't want to come to me and do like a brain health assessment, if you're not here because of your child or your ADHD symptoms, or and you're like, I feel awful coming out of the holidays and my brain fog is terrible now and I'm tired and my focus is worse, you are probably dealing with just kind of that toxic burden coming out of the holidays. And you need to do this level of detoxification with somebody who's trained in functional medicine, because these are pretty strong products. You cannot do this if you have cirrhosis of the liver, you have non-alcoholic fatty liver. You can't do this if there's any serious diagnosis, because this will liberate things too quickly and be too hard on those organs. Okay. People are so loosey goosey with these detoxes. They have to be careful. Okay. And if you would like the link to that, we can send you that link as well, because I don't think, Danica, I don't think you have the link to this. So we can get you the link to register for that. That just dropped yesterday. That just released yesterday. Okay. And then if you are interested in having a brain health assessment or some sort of intensive or a natural medicine workup, you just let us know, reach out to us. The website information, let me switch forward here. You can and minimize a little bit. You can go to the website. You can just take a picture of the slides. You can go to Doc Brownbush. You can call, text. You can totally just text us. You can email admin team at Doc Brownbush. These are all the ways to get a hold of us. Okay. And then Latasha, love. Oh, thank you. Ah, okay, that's fine. And you got the dates and the detox. Latasha, I have whole families. It has been quite the experience, and with whole families, so that happens a lot. I start with one, and then mom, dad, or a sibling or somebody is like, I think I need to have this too, because we all need a better brain. We really do. We all need a better brain. So there's nothing wrong with wanting to up level your brain and protect it across the lifespan. So I'm so glad that you got something that you could use today, and you understand that there is a better way. There's a holistic way that takes your whole system into account, and it's intense. But you do this once and then we're done. And I'll close on a success story. The last two Christmases, not this year, but the two previous Christmases, first Christmas I was on call, and second Christmas I already knew I was going to be on call, so I just went ahead and continued to work with this client. I had a young person who'd come to me in their 20s who'd been on medications for a variety of things, starting with ADHD, since they were 14 years old. And I got them. I was it. I'm usually it, by the way. They were at the end of their rope. The psychiatry kept upping all of the antipsychotics. They had gone from being diagnosed with ADHD to psychosis and schizophrenia and all these pretty severe diagnoses. And for 2 years, as the person recovered from ECT treatments and they recovered from all of these just medications, I had to be highly available. I would meet with this client initially for 2 to 3 days a week, and at and 2022 Christmas, I was meeting with this client 6 days a week. And so during the holidays, I was having to go somewhere and do appointments with this person because they were homicidal and they were suicidal as we were taking them off of the medications and putting them on my approach. And there was neurology and there was psychiatry as we stabilized this brain. When I met with the family in October, I said, I think this is going to be the first Christmas where all of you can be together, you can go away, and my client's not going to try to hurt anyone in the family or themselves, and I get to just be with my family. I don't have to pull over to the side of the road. I don't have to deal with, treatments and all these things. This client has been off of all medications for 1 year. They had become a drug addict. They have been clean for 2 years. Um, they they were suicidal and at risk of trying to harm one of their family members. They have fully integrated back into the family, and now we're talking about college. Now we're talking about college. All we did was this method. This family has lots of access financially. They could have anybody, and before me, they had everybody. And all I did was take this brain and body back to the fundamentals, and I tested. This person had Lyme disease, mycotoxin illness. They had multiple head injuries from playing football and from being hit in the head with numerous things. They had all kinds of trauma issues in their past. All of these things that they were doing and feeling were genuinely happening for them, and their brain was just sick. They just had a sick brain, and we had to detox this person and help them hyperbaric oxygen. We had to do red light therapy and saunas, but they're not on one medication, and they're taking a handful of supplements that any regular person off the street would have taken. Okay. So I want you to know this can do really heavy lifting, this intervention method, and can do light lifting, like just trying to focus. Okay. But I was really grateful to have a week and a half off for Christmas and not have to worry about this client and their family. And this is why I come and I do these. So I'm so glad, Latasha, that you felt that message from me. And then Amira, yes, 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 exactly. Those head injuries are no joke. Okay, okay, those head injuries. And Amira, um, we owe it to the children in our society so that they can grow up as adults with healthy brains and stable relationships and careers that make sense for them. We owe it to them to help them fix this while their brains haven't it's called myelination, they haven't closed. One of the things I kept telling this young man is we're not done with you yet. It ain't over yet. Your brain hasn't myelinated. Your brain doesn't myelinate till 26. I got time. That's what I kept saying to him. You don't know the healing power of a young body. And that was in the early 20s. So when I get these 12 and 13 and 14-year olds, I'll take a 9 to 10-year old is the youngest. I'll do functional medicine with a 5 or 6-year old, but just functional medicine because it's too much. But once they get to be 9 or 10 is when I'll start to work with them actually by myself, like bring me your child and just go somewhere, go rest mom. So yes, I will work with 5, 6-year olds, the youngest that I've done functional medicine with, but to do the brain balancing, I tend to like them at that 9, 10-year old range. Okay. And I do case consultations and I'll talk about your particular child situation. But I feel very strongly. I have a practice that is 50% young people because I really feel like it's my mission to help us save our children's brains. Because then if we teach them now, just imagine what happens in their 40s, 50s, and we start talking about Alzheimer's. They learn so much younger how to take care of it, and they love this stuff. When you teach your child about their brain health, instead of like there's something emotionally wrong with them, they don't like labels. You teach them about their brain health, they love that. They love it. And then they tell their friends. Okay. And then you have a community of healthier young people, which is just absolutely amazing. So I hope this did what it was supposed to. I shared this, I think you can tell, as a labor of love. And please reach out to me if you need my assistance, but you put to use what you got here, and I did my work. And Latasha is asking me a question or saying something. Marty, thank you for your continued support and continuing to be with me. I don't even know how long we've been together now, but I appreciate you continuing to show up and trust me. So thank you. And then Latasha, I'll let you type. Did you drop everything you needed to, Danica? Okay, Danica, I think everybody's typing. Yes. Okay, Danica says yes. Okay, Danica, you are good to go. I think I can do that. Is the application? Yes, the application. Latasha, you have been around for so many 2008. Isn't that amazing? That is so crazy. Okay, Latasha, you've been around for so many things. You don't need to fill out an application. If you just email us and say, hey, I need some information on an assessment, you can skip that because I think we've done a lot of different things at this point. So you're good to go. So, but if Linda, you're interested in like a mirror, because everybody's going to get this recording. If y'all are thinking, well, I don't know if this is right, you can fill out the application and we can proceed from there. I'm super grateful for this time I got to spend with you guys. I will stop talking now and I will see you in the next one. Okay. Take care. Yes. Very welcome.